Hi, future research assistant in training. This is the video for the urine test training. So to begin the urine test training, there's a box like this in every single room, a black box, and this is the box where you're going to be performing all the urine tests. The reason why we do the urine test is to check the cotinine level, if you guys don't know that yet, and this is one of our major data results. Okay, to begin, you first line the bottom of the box with a blue pad. All the equipment that we're going to be using is going to be somewhere around the box, so you can find all the equipment there. If something runs out, just ask Dr. Wen for more. Okay, so yeah, moving on. So we line the bottom of the box with the blue pad. The reason for that is if we spill the urine, it doesn't go all over the place and it'll just go absorb into that pad. 2 cups right here. First cup, you want to fill in the date. For the name part, you put the patient ID, and for the doctor part, you could put your own initial. All right. The one where you labeled is the urine that you're going to be keeping. The one that's not labeled, that's the one that you're going to be giving to the patient for them to pee into. Alright. And then we have this, the validity test. This is to check if it's really urine and not a yellow food color water. You're going to have a pregnancy test, a NIC alert, which is the cotinine strip to determine the cotinine level, and thermometer, and the thermometer probe. Now, we have one more thing, which is the card that shows how to interpret the results from the strip. Alright, so since we reused this card, we're going to be putting one of these cards into a Ziploc bag. Make sure when you put it in, the logo on the back is backwards, so you know when you put it in, this side is facing up with no interference from the label. Alright. A little thing about the pregnancy test. The pregnancy test obviously to make sure that the patient is really pregnant, or if they possibly had a miscarriage or something, or for postpartum patient, maybe they might even be pregnant again. Alright, the thermometer to check the temperature, to make sure the urine is fresh from them and they did not bring it in from somewhere else or from some other people outside. So ideally you want the thermometer to be above 95 degrees. Anything below 95, the thermometer will not register. In that case, you're gonna have to ask the patient to pee in the cup again during the visit, which could extend the visit a lot longer. Okay. So this is the general setup for a urine test.